Even with local and federal leaders making reassurances, this illness has Americans feeling worried. Tonight, KVUE's Bob Buckalew looks at a recent history of viral panic in the U.S.
October 2014, the virus known as Ebola dominated the news.
Dallas really on edge this morning. A new chapter this morning in the battle against Ebola.
Ebola is a vicious disease common in parts of Africa with a 50% death rate if left untreated. The scare in the U.S. began when Thomas Eric Duncan became infected in Liberia and traveled to Dallas, where he died a short time later. Fear spread through a Dallas neighborhood when two nurses who treated Duncan caught the virus. Public health officials ordered the decontamination of the nurses' homes. Over a 3-week period, nightly newscasts on the major networks aired nearly 1,000 stories on Ebola. 45% of the public said at the time that they were worried they might catch it. But that's extremely difficult unless someone comes into direct contact with the patient. And once Americans realized the risk was low, the scare subsided. In the end, only 2 people caught the Ebola virus in the U.S., the 2 nurses who later recovered. Unlike Ebola, the H1N1 swine flu outbreak of 2009 was a true global pandemic. Children were at particular risk, and many lined up in Central Texas to receive a dose of the flu vaccine. According to the CDC, 61 million Americans got sick with the H1N1 flu. Public health experts say the Ebola scare and the H1N1 epidemic taught them valuable lessons about how the U.S. can better prepare for future outbreaks, knowledge that will be tested as the latest coronavirus spreads. Bob Buckalew, KVUE News.